Hi guys, I'm Nihala. I'm studying in Antigen State Medical University. I'm going to talk about pneumothorax, its etiology, pathogenesis, symptoms, treatment, diagnosis, and like a basic things. First of all, pneumothorax. Pneumothorax is the presence of air in the pleural cavity, which leads to a partial or complete collapse of lungs in the affected site. It disturbs the negative pressure needed for lung expansion during inspiration. About etiology, it has spontaneous pneumothorax, primary and secondary. In primary, which is occurred without any underlying lung diseases, often seen in like tall and thin young males associated with the rupture of subpleural plebs, and in case of secondary, occur in the individual with underlying lung diseases like COPD, etc. And second is traumatic pneumothorax, which is blunt or penetrating chest traumas and iatrogenic causes, mechanical ventilation, central line placement, etc. And third one is tension pneumothorax, which is a life-threatening condition where an air enters the pleural cavity but cannot escape. And fourth is catamenial pneumothorax, which is rare, associated with the endometriosis. And this is all about etiology. Next is about pathogenesis. Pathogenesis, which is normally the pleural cavity's potential space with negative pressure. When the air enters this space, lungs recoils due to loss of negative intrapleural pressures, and alveolar collapse occurs in the affected site. And in tension pneumothorax, the accumulation of air under pressure compress both the lungs and mediastinal structure, which is including the heart and great vessels, compressing venous returns and cardiac output. Next is about symptoms. In common symptoms included sudden onset pleuritic chest pains, dyspnea, which is shortness of breath, tachycardia and tachypnea, cough. In tension pneumothorax, there is severe respiratory distress, tracheal deviation, hypotension and cyanosis, and also distended neck venous. And about diagnosis, there is clinical examination and imaging test, and also arterial blood gas test. In clinical examination, there is decreased or absence of breath sound is seen, and hyper resonance on percussion, and decreased chest expansion. In case of imaging test, which is there is chest X-ray and CT scan and ultrasound. And in the case of arterial blood gas, which is for hypoxemia and may be present. And in the case of treatment, depends on the type and severity. First of all, we observation, which is small asymptomatic primary spontaneous pneumothorax and high flow oxygen to increase the reabsorption of air. This is observation. And next is needle aspiration. For stable patients with moderate sized pneumothorax, they are using needle aspiration. And next is about chest tube, which is intracostal drainage. And there is moderate to large pneumothorax, secondary or traumatic pneumothorax, thorax, and tension pneumothorax. The chest tube is used for this type of pneumothorax. And about emergency needle decompression for tension pneumothorax. And large bore needle in the second intracostal space and midclavicular line. And about and last is surgical intervention, which is recurrent pneumothorax and for persistent air leak. And this all about pneumothorax. Thank you.